morning, everybody. My name is Mark Spector, and I'm president of Best Care Private Duty Nursing. This is our weekly video blog, and today's topic is what is private duty nursing? So, everybody may be aware of a program called the Medicare program. Medicare is something that most people feel provides a caregiver in your home for free. That's not actually true. The Medicare program does provide care in the home for those 65 or older, and while it technically is free, irrespective of certain co-pays or things that you may have, this program provides skilled, what we call skilled care. That is an RN, a registered nurse, a therapist, those kinds of caregivers in the home for a limited amount of time, which we call a visit. A visit can be anywhere from 15 minutes up to an hour and change. That's really about it. And that's not what's going to apply in the situation where we're dealing with private duty services. So, what if you needed more than an hour of care? What if, let's say, for example, your parent, your grandparent had a surgical procedure, came out of the hospital, was discharged, and then let's say in a scenario where this individual may be 65 or older, Medicare would send in if they had Medicare as opposed to an HMO, Medicare would send in a nurse to check vitals, go over meds, do wound care, injections if necessary. There may even be a recommendation for physical therapy to come in at a different point. But what's going to happen with things that we're going to refer to as ADL assistance with activities of daily living? Those are things that we would refer to as bathing, dressing, toileting, transferring. And when we say transferring, getting from the bed to the bathroom, bed to the couch, couch to the kitchen, going to the doctor, things like that. These kinds of services, care, are not going to be provided in most instances under the Medicare program. Now, there are some allotments for a bath visit to assist with bathing for a very limited time under the Medicare program, but that's about it. So, when we talk about private duty care, we're talking about ADL assistance, and that's where private duty comes in, and that's where I believe most people are going to need these kinds of services, irrespective of Medicare. It's probably a very necessary service that most people don't think about. At some point in their life, they're going to need it, or somebody that they know is going to need it. And private duty nursing is care provided by what we call in Florida. And again, this is very Florida specific. So these video blogs relate only to Florida because we're operating under Florida law, and that's what I would be referring to or describing. Private duty nursing with an aide is somebody either called a CNA, a certified nursing assistant, or a home health aide, which again is not an RN, not a registered nurse. This is an individual who is taken anywhere from 40 to 70 plus hours of training to provide ADL assistance. And this kind of individual is not an RN. Although in Florida we do have RNs that can supervise these individuals, RNs typically do not provide this kind of care. So when you are looking for private duty service, people will tend to say they want a nurse. Well, they're actually not going to get a nurse. This is not something a nurse does. There's the aide is actually more qualified to provide this service than a nurse because it's what they do all the time. So just understand that when you want private duty care, you're not getting an RN. And even an RN where people say in some instances will supervise the care, they're not really supervising. It's not as if they're coming into the home and staying hours, because you could have an aide for a couple hours a day, all the way up to 24 hours a day in a live-in situation. An RN, even if they do a supervisory visit, isn't really supervising the majority of the time, nor has that RN probably, unless they work as an aide, done the actual ADL assistance as well. So the person most qualified to provide this care is going to be the aide. Um, and that's also what the difference is in terms of who can get the service. When you're dealing with Medicare, you have to be 65 or older in order to qualify. Private duty nursing services can be provided to anybody of any age. In fact, our company, Best Care, provides services to individuals as young as infants for well care, so mom and dad need an extra pair of hands with their newborn, all the way up to ADL assistance with the geriatric population. So anybody of any age can receive ADL assistance, whereas with Medicare, not only are you limited to skilled nursing, you also have to be of a certain age. And that goes to the next portion of this, and that is, how are the services paid for? Well, in the private duty land, you have to pay for these services out of pocket unless you have had the foresight to purchase a long-term care or LTC policy, which is like any other insurance. It's an insurance policy specifically designed to cover the cost of private duty services. And then you'll want to find a company like Best Care that would accept what we call an assignment, meaning they will deal with the insurance company directly and get paid directly by the insurance company, so the policyholder doesn't have to worry about those kind of details. Um, there's other programs available in certain circumstances that might cover the cost of private duty services, such as the Veterans Administration. They have an aid and attendance program for veterans and their spouses. Again, it's income specific. Also, you may also have eligibility under the Medicaid program to cover home care services, but that would be income specific, and whatever state you're in would be in charge of direct that. So, for more information on private duty nursing, please go to our website at www.bestcare.net. That's www.bestcare.net. And that's the end of our video blog. I'll see you next time.